All right, so for lower extremity, I would start with observing the leg with socks off, shorts on. I would look for any abnormal skin patterns, edema, um, hair distribution. Um, I would then bilaterally check each leg for temperature and compare. I would then look at the toenails to see if there is any streaking, color, discoloring. I would compress to see if it has normal blood flow, watching it return to the pink color. Then I would move on to palpations. I would start with the dorsalis pedis pulse. I would find that, and then I would move on to the posterior tibialis pulse, right by the malleolus. And then I would move on to popliteal pulse, so I'd have them bend their leg a little bit, place my fingers behind, and lightly compress to find the pulse. All right, and then I would do femoral. So I'm going to roll your shorts up and feel for the pulse. Okay, and next I would check for pitting edema. So I would lightly compress the foot and see if it returns back to normal or takes some time. Then I would also check the calf muscle. I'm going to palpate in the inguinal area for the lymph nodes that run horizontal and vertical, just feeling to see if those are normal. I would then move on to auscultations. So I am going to listen to his femoral pulse for any brute or abnormal sounds patterns. Alright, and then I would do a hernia check on him. So I would palpate in the femoral area, have him turn his head away and cough. And that would indicate if there's any hernia of the abnormal raising or falling of the abdomen area. I would then do special tests. So I would start with Homans. So I'm going to take his leg and raise it to about 35 degrees, dorsiflex his foot, and squeeze the calf, and ask if there's any pain. This could indicate any clotting or vascular issue in the calf. Then I would do leg elevation. So I would raise his legs, both legs, and have him paddle his feet back and forth and hold this 30-60 seconds till all the blood is kind of drained out. And then I would have him slowly stand up, and I would watch the color slowly, or the blood flow back into his feet. And then I would do a venous tap test. So I'm going to palpate his thigh and lightly tap.